Hello friends, let's discuss about the osteology of radius. Radius is the lateral bone of forearm. It's a preaxial bone and it's homologous to the tibia of the leg. It's a long appendicular cartilaginous compact and spongy bone. Like any other long bone, it has a upper end, lower end and a shaft. The upper end is articulating with the capitulum of the humerus to form the humeroradial part of the elbow joint. Lower end is articulating with the scaphoid and lunate to form the radiocarpal joint. The upper end presents the disc-shaped head with a concave upper surface, a constricted neck below the head, and a radial tuberosity on the medial side, whereas shaft is triangular and progressively broadening from above downwards. The lower end is broad with 5 surfaces: anterior, lateral surface with a projection called as Starrett process, posterior surface with the tubercle of Lister, whereas the medial surface presents the ulnar notch for ulnar head. Inferior surface, as discussed earlier, forms the wrist joint. Attachments of the head is covered by articular capsule and related to annular ligament and supported on the medial side and below by the quadrate ligament. Posterior part of radial tuberosity gives attachment to biceps tendon. Coming to the shaft, shaft is triangular, presents 3 borders: anterior border and a sharp medial border or interosseous border, and a posterior border coming from the radial tuberosity to the Starrett process, and 3 surfaces: anterior surface or flexor surface, lateral surface between the anterior and posterior borders, and a posterior surface between the medial and posterior borders. Coming to the attachments of the shaft, remember rule of 2. Each surface will give attachment to 2 structure. Anterior surface to the origin of flexor pollicis longus above, you can see, and pronator quadratus, and anterior border gives attachment to flexor digitum superficialis. Lateral surface to the 2 muscles, insertion of supinator above and pronator teres in the middle part, whereas posterior surface gives origin to the 2 muscles, abductor pollicis longus and extensor pollicis brevis below. So these are the attachments of the shaft. Remember rule of 2. Coming to the lower end here, and before that medial border, it is giving attachment to interosseous membrane, and as you see the lower end, the Starrett process, and this lower end is having these all ligaments attached to it, and that is a insertion of brachioradialis. Posterior surface is related to extensor tendons. So this is the radioulnar joint that you see. That is the cavity of the radioulnar joint. So that's it about the radius. Thank you.